My name is Lana Rich, and this is my presentation on MRSA. FP is a 77-year-old male with no known allergies. He is a full code, 5'9", and weighs 129 pounds. He was transferred from Dignity Health Hospital in Prescott to Aspire on 3/29. Patient presented with MRSA infection with osteomyelitis on his left foot with a wound vac. Patient history includes atherosclerotic heart and E. coli. The patient's treatment while at Aspire includes receiving vancomycin antibiotic therapy through his PICC line. After 2 weeks of unsuccessful treatment, the patient was sent to FMC emergency room for below-the-knee amputation due to necrotizing tissue. The patient was ANO times 4, agitated, and reported pain of 7 out of 10. He has a PICC line in his left arm. Upper extremity pulses are strong and equal. Left lower extremity pulse was not assessed due to wound vac oversight. Right lower extremity pulse was weak. He presented with clear lung sounds, slight tachypnea when repositioned, had daily soft formed brown bowel movements, normal bowel sounds in all 4 quadrants. Patient has stage 1 pressure wound on sacrum with foam dressing, stage 1 pressure wound on right heel with foam heel protector boot, floated on pillows, wound vac on right foot. The patient is weak and has difficulty repositioning self and is a 2-person assist. The patient's vancomycin trough level was drawn weekly. The first week he was there, his level was 12.8. The second week was 18.6. He had CBCs done weekly. His hemoglobin was 7.8, and a CT of his foot which showed necrotizing tissue which resulted in a send out to the ER. Nursing diagnosis 1, less than body requirements related to inadequate nutrition as evidenced by low BMI, weakness, poor wound healing. The goal was for the patient to understand how important eating enough nutritious foods and taking prescribed medications and vitamins are to his health. Interventions include educating the patient on the importance of nutrition, encourage patient to eat small, frequent meals, and teach about meal plans that include high-calorie, high-protein foods. Nursing diagnosis 2. Acute pain related to infected wound opening as evidenced by patient statements about pain. Goal, patient's pain is under control and does not get above 3 out of 10. Interventions include consistently assess the patient's level of pain to make sure patient gets pain meds before pain gets intolerable. Teach non-pharmacologic interventions for pain such as breathing techniques, repositioning, and hot and cold packs. Teach patient to rest when they've reached their limits on moving around and make sure patient is aware of their limits. Nursing diagnosis 3. Risk for ADL deficit related to weakness and immobility for patient. Goal. Patient will understand limits and ask for help when necessary. Interventions include having assistive devices available such as wheelchair and walker to help with transportation of patient. Place call light within reach of patient. Encourage the use of bedside commode. In this article, vancomycin is being questioned as the first-line drug of choice for MRSA due to high failure rates. There were 95 patients in the study that had MRSA along with pneumonia, bacteremia, or skin and soft tissue infections. These patients received a concentration of 4 to 5 times more than the normal concentration of vanco, and the results were similar to those with the patients that received the lower levels of vancomycin. Patients with osteomyelitis were tested 154 minutes after the infusion and had trough levels of 12. Their bone penetration of vanco was 30% higher than those with healthy bone. The study discusses that alternative treatment against MRSA with osteomyelitis is recommended because of the site being too difficult to penetrate. FP's situation supports the study. Our patient was not successfully treated with vanco and ended up getting a below-the-knee amputation because his MRSA turned into necrotizing tissue. FP was non-compliant with his medication regimen and malnourished, which I believe played a role in his unsuccessful treatment. He may have also waited too long to seek out treatment once the infection had presented itself. Unfortunately, vancomycin has not been successful in treating many MRSA infections, which is shown in the research article and may be the result of the MRSA strain becoming resistant to vanco.